Cocaine and emotion. What are the effects of cocaine dependency on emotion regulation? Cocaine is an addictive, illegal substance that has been around since the early 1400s. This image is an advertisement for cocaine as an anesthetic, one of its first uses. Cocaine affects the body in numerous ways. Neurologically, the brain experiences a euphoric feeling due to cocaine's ability to inhibit the normal cycle of the dopamine system. This allows dopamine to build up and create an overwhelming sense of pleasure throughout the body. Cocaine can cause the body's temperature to increase, as well as the heart rate. It can reduce a person's appetite and cause dilated pupils and dry mouth. It can also provide a greater sense of alertness, energy, and desensitization to pain. A person who uses cocaine may experience psychological effects such as higher levels of confidence, excitability, and sociability. Some more negative psychological effects may occur, such as restlessness, aggression, anxiety, hallucinations, and delusional thoughts, these all resulting in a range of emotions. Emotion regulation involves an individual influencing the emotions that they have, when they occur, and how they are expressed. An example of emotion regulation may be someone continuing to attend a social event and express feelings of happiness after being offended by someone at that event. Cocaine-dependent individuals lack the ability to regulate their emotions. This involves a reduced understanding of their own emotions, difficulty using emotional coping strategies, and controlling inappropriate or impulsive behavior in times of stress. To link back to the previous example, a person who is under the influence of cocaine who has just been offended by someone at a social event may be more inclined to express feelings of anger or aggression towards that person or other people around them. There is evidence to say that cocaine-dependent individuals have shown increased activity in areas of the brain associated with negative emotional appraisal, thus meaning that they are more inclined to experience negative emotions towards a situation and negative affectivity. This is the frequent experience of negative emotions. Poor emotion regulation is also associated with poor emotional coping strategies. Negative affectivity paired with poor coping strategies often leads to social isolation. Social isolation can have detrimental effects on anyone's emotional well-being. In conjunction with cocaine dependency, social isolation can cause the drug dependency to be maintained, resulting in a vicious cycle of addiction. Cocaine is an addictive substance that has serious effects on the brain, body, and the mind. When a cocaine dependency occurs, these effects cause an individual to experience an inability to perform emotion regulation. This plays a role in the vicious cycle of addiction, as poor emotion regulation has a range of negative outcomes such as negative affectivity, poor coping strategies, and social isolation. To expand your knowledge further on what has been covered in this presentation, hit the link in the description to the 2020 Motivation and Emotion textbook to read the chapter on cocaine and emotion, as well as many other chapters that cover a range of interesting topics. Thank you.